Finally, with regards to modifications that would be made for special populations when doing my program or the program I've just demonstrated. The first one is asthma. Asthma is a condition that affects a person's respiratory system by the airways becoming inflamed and narrowed, which makes it hard for the person to breathe and causes them to be short of breath. However, once diagnosed, asthma is often usually easily managed through medication. So with someone who has indicated on their pre-questionnaire that they do suffer from asthma, I would ensure that they had clearance from their doctor, as with any condition that's been indicated in their questionnaire. And I would also ensure that every session they came to, whether at cardio or resistance training, any session, that they brought their asthma medication with them. With regards to someone who's doing cardio and asthma, I'd closely monitor their breathing throughout the cardio workout in particular, and to modify the workout, I'd lower the intensity of the session by decreasing the speed and incline of the treadmill, and I'd stop the session as soon as the client began to show any signs of asthma. The second condition I would like to speak to you about is hypertension, which is also known as high blood pressure. Blood pressure is the amount of force exerted on the heart's artery walls by the pumping of the blood. Someone with hypertension occurs when the blood is pumping at a greater force than normal. Often they can show no signs of hypertension, but it depends on what their blood pressure is to be diagnosed with it. If they have a resting heart rate of 140/90, then they're diagnosed as having hypertension. When doing strength training with someone who has hypertension, I would increase the rest periods between sets, and I would decrease the amount of weight used per set and concentrate more on higher reps with lower weights, as opposed to heavier weights with lower reps, with the aim of decreasing the strain on the heart. This will still give the client a workout for the muscles they intend without putting extra pressure and strain on the heart. The final condition I'd like to speak to you about or explain is arthritis. Arthritis is a condition which can cause the joints to become stiff and the surrounding muscles can become inflamed and swollen, which can cause quite a bit of pain in that area, along with stiffness, which can restrict the movement and mobility of the joint that is affected by arthritis. Resistance training is beneficial to someone suffering from arthritis, as it can increase the muscle strength in the area surrounding the joint, which in turn allows for an increase in movement and mobility as the muscle around that joint becomes stronger. This allows for the load of the joint to be reduced as the muscles start working as they should, and rather than just the joint carrying the load of the movement, the muscles actually support the joint as they are supposed to do. When training a client with arthritis, again, I would start with low weights and lower reps, and then slowly increase to get strength into that area. I would also have them seated for some exercises, just to avoid extra strain on their joints until they were able to get some strength into them. That's what I would do for the 3 conditions that have been outlined. Thanks.